I'm doing hip bone very quickly to fix it on the bony pelvis very quickly. So we can compare all of them. This is one hip bone composed of three parts: ilium, then pubis, and then ischium. Okay, ilium, iliac crest. I'm just going you the names quickly so that just it's a revision site. So iliac crest, anterior superior iliac spine, posterior superior iliac spine, anterior inferior iliac spine, posterior inferior iliac spine. Good? So four spines. Anterior border, iliopectineal line, iliopectineal line. Alar surface for connection with the joint, making a joint with the sacrum, sacroiliac joint. This all is iliac crest. Okay. This is iliac surface, iliac fossa. Here is the iliacus muscle. See, here is the iliacus muscle attached. Then iliopubic eminence. Eminence yani a bit elevation. Then pubic bone. What are the important features? Pubic ramus.
Superior.
Yes. Then and pubic tubercle. Hair crest. Here symphysis pubis. Obturator foramen. Ischium bone with ischial tuberosity and ischial spine. Again, ischial tuberosity, ischial spine. Ischiopubic ramus. Last?
Yes. What?
Someone told me that this is called iliac spine.
No. There is no iliac spine. Ischial spine.
I know that.
Ischial spine. Ischial tuberosity, ischial spine, ischium bone. Ilium is here, so there is no ilium spine. Come to me later on. Tell me in mind. Okay, so this is about, one is hip bone. If I combine two, this is hip girdle. If I put a sacrum and coccyx, then it is pelvis. Without lumbar vertebra, okay? No lumbar vertebra. Now, let's start the pelvis. So, this is the pelvis. This should be in line. So, the anatomical position is not straight like this. It's like tilted. So, if you make it on the ground, you must make an angle of inlet with the ground with a horizontal around 40 to around 50. This is the anatomical position. Now, here, what is pelvic inlet? So, here is the pelvic inlet. This line is the pelvic inlet. What makes the inlet? Now you know the sacrum. So sacral promontory, the elevated front part of this bone is sacral promontory. So this is sacral promontory. From sacrum, then on the sacrum, then I will go to iliopectineal line here, iliopectineal line here until I reach the symphysis pubis. So this is actually the pelvic inlet. Okay. Above this is the false pelvis. So, what makes the false pelvis? My anterior abdominal wall here. Okay? Then, on the back, lumbar vertebrae. On the sides, iliac fossa with iliacus muscle. This is false pelvis. What is false pelvis? It's greater, of course, than the pelvic cavity. Then, it is the area for the head of the fetus will come, and it is the first catching area for the head to get engaged into the pelvis really. So this is what we call as pelvic inlet. After the inlet, okay, here are the lumbar vertebrae, lumbar 4, lumbar 5, and then we have sacrum. Okay. Then some features of the sacrum you have already been done, and then here is the coccyx. Secondary cartilaginous joint, symphysis pubis. Why I say secondary? Because it has two types of cartilages. On the margins, we have hyaline cartilage, thin, and then in the middle we have fibrocartilage disc. Same is happening with intervertebral disc. Hyaline cartilage, in between is the disc. And similar type here, sacrococcygeal joint. Okay? Now, where is the cavity? Here inside, this is the cavity. Where is the inlet, outlet? Here is the outlet. To see the outlet with the ligaments is very helpful to understand the real outlet. Let's do the ligament. Now you know the bones. Okay. So inguinal ligament from anterior superior leg spine to the pivot tubercle. Inguinal ligament. Then here is the anterior ligament for the sacroiliac joint. Similarly, posterior ligament. For symphysis pubis, one here superior, one here inferior. For this joint, one anterior, one posterior, anterocious. Posterior, it's mixed with multiple ligaments.
Isn't
Can't
it
say that.
Thalossus is
Not
between the
anterocious.
sacrum and the-
Anterior sacrococcygeal, posterior sacrococcygeal.
And then
Anterocious is only mojood in between the sacrum and ilium, only.
Yeah.
Okay. Then the other ligaments which you see here is, okay, before the ligament, you see the greater sciatic notch.
Yes.
Then you see lesser sciatic notch. This is my right side, this is right side of the right sided bone. Greater sciatic notch, lesser sciatic notch. Ischial spine, ischial tuberosity. So now here you see the notches are covered with this strong ligament from sacrum, posterior superior iliac spine to the ischial tuberosity. Sacrotuberous for tuberosity. Sacrotuberous ligament. Then we have sacrospinous. Sacrospinous, spine of the ischium. So spine of the ischium. So sacrotuberous ligament, sacrospinous ligament. Now this greater sciatic notch is greater sciatic foramen, and the lesser sciatic notch is lesser sciatic foramen. Where is pelvic diaphragm? Consider this as pelvic diaphragm. This is the position. Okay? It composed of two big muscles. You can see here in front, all this is levator ani. And this back, this one, is coccygeus. See from the inferior aspect, it's more easy. Levator ani, coccygeus. Okay. Then I told you levator ani has 4 different type of fibers. Of course, they are not demarcated here, but you can guess anterior fibers, then middle fibers, then the posterior fibers. This big ones, posterior fibers. Okay?
Yes.
I told you that diaphragm is deficient in front. Why? Because for the passage of urinary and genital tracts. Understanding? So this is how I look for the pelvic diaphragm. Where is the actual location of the pelvic diaphragm? Here is the actual location of pelvic diaphragm, like this.
Yes.
Now understanding? Good? This is how you look for the pelvic diaphragm. Now the question is, what is here outside? Is actually the perineum. This is actually the perineum.
Yes.
So we are not dealing with the perineum at the moment. So this is the perineum. Here is the pelvic diaphragm. In association with pelvic diaphragm, here in front, obturator internus. So I remove the diaphragm, here obturator internus. Good?
Good.
Piriformis is not visible in this model, but where is piriformis actually? From the front of the sacrum, from here, the fibers they arise, then it will make a fusiform like structure, and it will come from greater sciatic notch or foramen to get out, and here is the greater trochanter of femur, it will attach to the greater trochanter of femur. Here I cannot show you, but of course here I can show you some fibers of, this is sacral plexus, lumbosacral plexus, the yellow. The muscle behind this yellow is actually the piriformis. Okay? The piriformis fiber go from here, go where? See from the back. They will come here. Piriformis is known as the key feature for the gluteal region. This is the gluteal region. I remove the gluteus maximus. Once I find piriformis, how to find sciatic nerve is just below the piriformis. So this is piriformis. So once I know the piriformis, it's easy for me to identify superior gluteal vessels, inferior gluteal vessels, superior gluteal nerves, inferior gluteal nerves, especially the sciatic nerve and other muscles like obturator internus, quadratus and others. Okay? So this is your piriformis. Whereas the pelvic diaphragm should be here, it should be like here. Okay? This is the pelvic diaphragm. Now, let us find any other thing which is left. Ligaments done. Here. This all is only levator and eye. This is the anterior part. Yes. No, sorry. This is the anterior part.
Yes.
This all is levator and eye. This is a female pelvis showing you 3 openings in the anterior aspect of the levator and eye. The front one for urethra, then vagina, and then the rectum. And you know there are some slings for the anorectal junction, puborectalis. So this is like the same. Then on the cadavers, if you could see, this is, I told you, the greater pelvis or the false pelvis with an anterior abdominal wall. So this is anterior abdominal wall.
Yes.
Okay, like here I told you, anterior abdominal wall on both the sides. So of course this is the anterior abdominal wall. This is the lumbar vertebra. So I am dealing with the greater pelvis here. Where is the pelvic inlet? This is the pelvic inlet. This is the pelvic inlet. Iliopectineal line. Here is the promontory for sacrum. Okay. What are other structures visible here? Iliacus, iliac crest with iliac fossa and iliacus muscle. And psoas muscle, psoas major. Psoas major. Iliopsoas will make one tendon. These are the flexors for the hip. Okay. Then just imagine this pelvic diaphragm, put it here. Okay. Then try to identify the parts keeping this view and then here. So let's see. So this anterior part, this all anterior part is like levator and eye. See, the back here is coccygeus.
Yes.
Obturator should be here on this margin because I told you obturator is here in this relation.
Yeah.
So obturator is here, and the best thing here is to find obturator foramen with obturator nerve. Obturator nerve.
What is the foramen?
Yes, this is the foramen. Where is the yes? This is the foramen. Where is the foramen here? On the membrane, I should identify it. So this is obturator foramen, obturator membrane, and here is the obturator canal. This is known as obturator canal. So this is actually the obturator canal. This is actually obturator canal with obturator nerve. Good? This is symphysis pubis. This is iliopectineal line, symphysis pubis. This is rectum. And this is the cut part of sacrum, and this is the cut part of coccyx. On the posterior aspect, this is the gluteus maximus. If I try to remove it here, then you will find piriformis. Piriformis. I told you sciatic nerve, ideally, routinely it divides where? In the upper part of popliteal fossa. See this model. This is the sciatic nerve.
Yes.
Here it divides. Sometimes it divides into 2 components, tibial and common peroneal. Sometimes, I think this is a variation in this body. Both of them, they are having separate origin. See here, see here. Okay, so this is sciatic nerve basically. Then, okay, finish for this. Here in this female pelvis, we have this iliacus muscle, psoas muscle, psoas major, aorta dividing into, bifurcating into common iliac and then external and internal iliac. Here should be the inguinal ligament. This is more than inguinal ligament. Why I am saying more? Because some part of abdomen and some part of lower limb is attached. So ideally this is inguinal ligament. Here you will find this is the inguinal ligament. Okay, it's a demarcation between abdomen here and the lower limb start point. You will find blood vessels going behind the inguinal ligament and everything. That is not our objective at the moment. Here is the pelvis, the pelvic cavity. Okay, you can see it like this, pelvic cavity. But unfortunately, the muscles are not in a very good shape to show you. If we can guess the front, this part is levator and I, the posterior is like here. The anterior front part is levator and I, the posterior margin is coccygeus. Here we have obturator, and here we have piriformis. Okay?
Clear.
Uh,
Everything.
any questions?
No.
I think this is enough for us today.